Okay, we try part C. So using a diagram, explain one demand and one supply factor that will affect the market for healthcare in the United States and comment on whether the change in price is likely to persist. Okay, so again, there are two parts, 8 marks. One demand, one supply factor, and then comment whether the change in price is likely to persist using a diagram also. Okay, so let's go and look at the extract. All right, so we're doing part C here. Okay, same case study, we're doing part C over here. All right, so let's go up, extract 1. Let's see if there's anything. Okay, I'm not sure. So for the past century or more, health improvements from vaccines, antibiotics, sanitation, nutrition have saved millions of lives. They have been a powerful catalyst for economic growth. Better health promotes economic growth by expanding the labor force, boosting productivity. However, in recent years, a focus on rising healthcare costs, especially in mature market economies, has dominated the policy debate, whereas health as an investment for economic return has largely been absent from the discussion. Okay, so anything here that mentions the changes in the market for healthcare in the US, demand or supply factor. Okay, so here, right, actually, yeah, it's already. So, however, in recent years, a focus on rising healthcare costs. Okay, so this part doesn't say much, it's just healthcare costs rising. So we can highlight this. All right, we can highlight this. This one could be useful. All right, so this is a supply factor. So extract 1, this one, rising healthcare costs. Okay, so let's move on. So total healthcare expenditure per capita, this just means how much they're spending. Then we move on to extract 2, economics of the US healthcare system. So healthcare sector is in many ways the most consequential part of the US economy. It is a fundamental part of people's lives, supporting the health and well-being and a prerequisite for a well-functioning economy. Unfortunately, the problems with the healthcare are substantial. Healthcare expenditure is growing, government budgets are also growing. This growth represents a range of factors from adoption of new technologies for new healthcare treatments and services and higher utilization of medical services. Some changes are desirable. As a country gets richer, spending a higher share of income on health may be optimal. Countries with a higher level of output tend to have a higher level of health expenditures per capita. In addition, as the population ages, health deteriorates and healthcare spending naturally rises. Okay, any factors here affecting healthcare in the US? Okay, so here, increasing income level, this could be 1, right? Gets richer, spending health. Yeah, okay, it's actually highlighted. Okay, so next part, any second reason, second factor? Let's say we don't want to talk about income. Is there anything else we can mention? Okay, cost of production, this one same as here, right? So that's on the supply side. Demand side, we can talk about income. Let's say we don't want to talk about income. Anything else? Aging population. Okay, so the last line, health gets worse, people spend more on healthcare. Okay, make sense? Make sense? Okay, so across the board, so extract 1, we have 1 supply factor, rising healthcare costs. Extract 2, mainly we talk about the income and also the aging population. Last line, population ages. All right. 1 demand, then second demand. So we only need to choose 1 out of them. Okay, so that will give us the whole. Let me see. Okay, so coming back to C, it says here one demand, 1 supply factor that will affect the market for healthcare in the US. So they say the word market. That means you have to talk about what in your answer. So demand and supply will explain, right? Then at the end, because they say affect the market for healthcare. So our answer have to mention which concepts at the end. After you draw your diagram, everything finish, then we have to mention the changes in price, quantity, right? These 2 things. Okay, so that means there should be some sort of a conflict later on. Okay, so price and quantity, either one, there will be a conflict later because you have demand shift and supply shift. Okay, so address those later. All right, so this one we'll try out. Okay, this is part C. Okay. So we check through because we know there are 4 things to include, right? So just check through whether we have everything. Extract 1 mentioned the rising healthcare cost. This is what happened, right? This is the trigger. Then we need to explain, right? So they may be buying more expensive treatments. They may be producing using more expensive equipment. Wages of the nurses may be higher, etc. So with higher costs, profitability falls. Okay, so we give the reasons why there is a higher cost. Then you say the impact, which is leading to lower profitability. Okay, so that's your second step. Third step, we say that the supply is going to fall, right? So with all these changes, supply demand will be affected. So supply is falling. Last part, supply curve shifts leftwards. Okay, standard. Okay, then let's move on to the next one, the demand factor. So same thing we check through, huh? So second paragraph, we say that there is aging population. And second part, we say there is aging population, so more people needing healthcare services because of the diseases that come about. So this is explanation. Third part, we say there is an increase in demand. Fourth part, demand curve shifts rightwards. Okay, so make sure you have the same 4 steps. All right, so 4 steps, 4 steps. So before we move on, we need to sort through the individual changes first. Right, so let's say we write here. So with a fall in supply, supply falls, there would be what changes in price? Okay, so higher price. So price rises, then quantity decrease, falls. Then same exercise here. Demand rises, then price rising. Okay, rises, then quantity rises. Okay. So we need this, then we can look at the combined effect. So when we combine together, price will increase, price will increase. Okay? Then quantity here will drop, quantity here will increase. Okay? So we need to sort out how is the quantity going to change overall. Okay? So let's see if they mention anything about quantity. Okay, come together, together. Otherwise, I'm the only one doing. These are the extracts. Anything that we can use to help us decide if quantity will increase or decrease overall. Okay, so is the supply going to drop tremendously or is the demand going to increase tremendously? Okay, maybe from here or it could be from here. So how? We need to sort out first, all right? Otherwise, we cannot draw, cannot explain. Demand increase more or supply decrease more? 50-50. Okay, so here mentions that it is probably going to be demand increasing more. You can give reasons such as like the population will get older and older, right? And the incomes will be increasing as well. So these are factors that will drive up the demand, right? Whereas here for supply, the pace of increase may be less. Okay, so it's not going to increase like so much forever, right? So relative to like the population size, the income increase, that should be a bigger factor. Okay, so then we're going to include that portion. So next part, now we are able to draw the diagram. So we will draw in the diagram. Okay, should be easy, huh? So we're going to draw in the demand supply first. So market for healthcare in the US. Okay, so if you want, you can label. Some of the schools, they will focus on the labels as well for presentation. So if you want, then you can just make your presentation nicer. D and then price. Okay, so we will start with the basic demand supply first. Then we're going to shift the curves, right? So we said that demand will shift more than supply. Okay, so when you shift the demand curve, remember to leave a bigger gap. So let's say here, demand shifts more. This time, remember your arrow. Okay, this one we need arrow, huh? And supply curve will shift left here. All right, so overall D1S1, this will give us the new equilibrium point, then P1 as well. Okay, so remember the arrows, remember the size of your shifts, DS1, and here P1. Okay, so the overall change. Then the last part, if you recall, we need to talk about adjustment process. So we start from P0, then we extend the dotted line to the last curve on the right side. Here we get, and then here from S1, we will get QS. All right, so QD, QS, This will give us a very big shortage. Then we include the arrows pointing towards the new equilibrium points. Okay, same thing here. Okay, done, huh? So diagram here. Okay, after we've drawn, how do we start? What's the next part? Exam soon. This one I've done 6, 7 times. After we draw, then what happened? Okay. Okay, can. Thank you. So first thing, demand curve shifts right, then supply curve shifts left, D0 to D1, S0 to S1. Okay, once we are done, then we start to explain the adjustment process. Okay, so market price at P0 first. Now we experience a shortage. So shortage will highlight. Then after that, we have to explain that quantity demanded exceeds quantity supplied. Okay, so don't say demand more than supply, huh? So we are looking at the price P0. So at this specific price, quantity demanded is more than quantity supplied. Okay, QD more than QS. Then after that, there is upward pressure on price. So something is pushing the prices upwards. After that, it will start to increase. Okay, so prices are going up. So as the price increases, quantity demanded falls, quantity supplied also increases. Okay, again, use quantity, don't say demand falls, supply increases. After that, at the new equilibrium, market price has increased, P0 to P1, market quantity has increased from Q0 to Q1. All right, so this will be the adjustment process. Then we can explain as well why we feel that we should draw it this way. Okay, why do we feel that demand should shift more? So last part, just give the reason. Then we go to the second half of the question. Okay, previous part done, huh? So I scroll up all the way. See that. So this part is just explaining why demand increases more, because from our understanding, it is likely that the larger population, right, a large population, then a big proportion will be aging and then earning higher incomes. So there will be a big increase in demand for healthcare. Okay, all right. So this part done. Then we look at the second shorter part of the question. So it asks us to comment. Okay, here. All right. So it asks us to comment if this change, this portion, huh? So comment whether the change in price is likely to persist. Okay, so the change in price is general, is generic. So based on our answer, it will increase, right? So that's why here we say that the increase in price. Okay, so now is it going to continue or not? Will it continue rising, or will it stop or even reduce in the future? Okay, so again, based on extracts 1 and 2 only. The rest talks about other things. So if we focus on these two extracts, did they give any reasons as to the trend of the price? So extract 1 says that it is healthcare is important. It helps with economic growth, productivity. Then there is rising cost. That's 1. Figure 1 shows us how much they are spending across the years. You can see that this is for US. US spending more and more on healthcare. Extract 2 talks about the changes in demand, right? So we mentioned the income change, aging population. We also say that the government is spending more and more of the budget on healthcare. Okay, so looking at all this, is it likely that the prices will keep increasing for healthcare? Yes. Okay, then we can use that. So we'll try D1. D1 also quite straightforward, just 4 marks. Suggest possible reasons for the difference in the PED values between brand name and generic drugs in table 1 for Taiwan and the US. Okay, so we look at this above, and these are the numbers. So brand name drugs, these are branded. So it could be like brand ABC. Whereas for generic drugs, there could be like no brand. Okay, it's just like, okay, this is Panadol. So in Taiwan's case, PED value for brand name is negative 1.72. For generic, it's negative 0.55. In the case of US, for brand name drugs, it is negative 0.55. Generic, it's negative 1.72. Okay, so they need the reasons why it is the opposite in both countries. Okay, or don't say country, in both places. So then in this case, you have to mention the understanding first. So in terms of PD value, right, looking at these numbers, what does it tell us? Then we look at the reasons. So probably 4 marks, and they say to suggest possible reasons, you will need to come up with 2. So 2 marks for each. So when we explain like, okay, this is the value, the demand is price elastic, price inelastic, that part will not carry the marks. Okay, but we still need to write that. Otherwise, we confuse ourselves. Okay, so we decipher first. So negative 1.72 elastic or inelastic? Elastic. Okay. Then 0.55 inelastic. Okay, so we write this first. So this one, in case we have forgotten how to read the numbers, all right, if you look at the table from table 1, negative, all the signs will ignore the negative signs. Okay, wait, here. Okay, so we'll ignore all the negative signs. We are only looking at the number. Okay, more than 1, it's price elastic. Less than 1, it's price inelastic. Okay, so coming back, the question asks us for possible reasons. Suggest possible reasons. Okay, then if you scan through extract 3, you just tell us what the 2 types of drugs are. So if you look at this, right, it says often it takes multiple generic drug companies to achieve the promised for downward pressure on prices, where generic drugs are the chemical copies of the original brand name drug with the same active ingredients. Okay, so we copy the formula we use, we produce and sell cheaper. The US government gives patent and exclusivity and protection to brand manufacturers, allowing them to profit from their innovation and research for several years. During this time, no generic drug company can compete with the brand. Once the patent has expired, generic drug companies can enter the market through this approval process. For some classes of generic drugs, prices are so low that manufacturers may leave the marketplace. For many generic drugs critical to patient care, there are no more savings to squeeze out. And said this company, if we continue to do that, they will go away. Some manufacturers also already produce at a loss. Okay, so they didn't give us a reason. It only tells us what the generic drugs and the brand name drugs are. Brand name is like my invention. I created the first prototype, something. Then when it's ready to sell, right, I'll file for patent so that no one can use my idea. Once the patent has expired, then other companies will come in. Okay, so now we are interested in the reasons for why. Here it is price elastic for brand name, price inelastic for generic, price inelastic for brand name, price elastic for generic. Okay, so let's say in Taiwan, right? Let's say in Taiwan, in terms of brand name drugs, they are very price sensitive. In terms of the generic drugs, they are less price sensitive. Okay, and vice versa for the US. So what could be reasons why the PD values are like that? Okay, Ken, this one first. Thank you. Okay, so here we say that for brand name, it's going to be more expensive, right? It's going to be more expensive. Therefore, they will be very particular or very sensitive about the price. So here they will be more like, okay, maybe I don't buy, right? Increase a bit, I don't buy. Whereas in the case of US, right, it's opposite. So for the brand names, they're like, okay, increase, right, I'll still pay. I don't really mind the price. Okay, so one reason could be because of the proportion of the income spent on the brand name drugs and also compared to the generic drugs. Yeah, so one reason, worth it. Yeah, 2 reasons. Not worth it. Once you're done, we look at the second reason. So here we focus mainly on the brand name drugs, right? Then if you compare with the generic drugs, it's the opposite. So for generic drugs, in Taiwan, it is price inelastic, whereas for US, it is considered price elastic. So for consumers in Taiwan, even if the price go up for generic drugs, they will still buy. For US, right, they will look at the price. To them, they're like, okay, let's not buy, right, when it gets a bit more expensive. Okay, so why the case for generic drugs? Okay, done, let's go back. So here, so generic drugs, right, we flip around. In Taiwan, it's price inelastic. For US, it is price elastic. Okay, Any reasons for that? Okay. So, okay, let's say the degree of necessity. Anything to use? Degree of necessity or substitute. If you want to talk about substitution, also can. So, okay, substitution, that means here we'll say that for the Taiwanese consumers, right, one way is this is considered as high degree of necessity. Okay, so for them, this is like the main type of drugs they take. Whereas for here, right, this is not the main type because they will usually take brand name drugs. Let's say they prefer the brands. Okay, then if you talk about substitution, for the Taiwanese consumers, they do not see both as substitutes. This is the cheaper version. It cannot be replaced by the brand name drugs. So then they will not go for those. So for this is the only choice. In the US case, right, they may prefer the brand name because to them it's higher quality. So for them, there is a substitute. We could choose generic sometimes, but if it gets a bit more expensive, then we might as well go for brand name. Okay, so then both are considered substitutes to them. Of course, they will prefer brand name because it's higher quality. Okay, all right. Okay, let's move on. Then last part for this. Sorry. D part 2. Oh, D part 2 from elasticity. We have time next week we can go through. Okay, so bring this first. All right, bring this first. Then remember to read. Best if you can read this, the whole thing, maybe like 10 times. Then all the previous notes, 1 to 4, also just read about 10, 20 times. Okay, then we'll be ready for the exam. Okay, I'll see you. Yes, it will cover market failure. Market failure will have the most marks. No macro. Okay, this one scan already, Scan already, because I'll forget. Okay, later on, end of the month, when I do attendance, then I'll just base on the results. Okay, scan already? Scan. Okay, all scan, Alright. Oh no.